y'all, Shelly here with another tip for hospice nurses. So when I first became a hospice nurse, I struggled a lot with not having immediate access to diagnostic testing. Like I was used to coming from the acute care setting where we had state-of-the-art diagnostics all the time. Into hospice, when something would change with our patient, I really wanted to know what was going on. And I struggled with that a lot. And I was fortunate to have a really amazing preceptor, and I worked with a wonderful medical director, and they helped me to understand that in hospice, we treat the patient. We don't necessarily treat the machine or treat the test. We treat the patient. So let's say that you have a patient who has symptoms of an MI. So what do? The first thing we do is we're going to go in and treat their symptoms. We're going to relieve the pain with whatever's ordered to treat for that patient. Then we call the doctor, and pretty much probably what the doctor is going to say is, well, what does the patient want to do? At that point, we have the discussion with the patient, and we inform the patient of their options. They really have two options. They can stay on hospice, and if this occurs again, then we're going to treat it again, just like we did. We're going to make sure that they stay comfortable, and everything will just kind of keep going on like it is. Or they can revoke hospice, they stop hospice, and they can go to the hospital, and they can have all the tests done. And then once the tests are done, they can decide what treatment they want to have, whether it be like an angioplasty or even open heart surgery or whatever it is. So I help the patients to try and figure out, do you want to have treatment? Because if you do, then it's very appropriate for you to stop hospice and go to the hospital. And we're not going to be upset with you. We're going to support you through this, and we'll help facilitate everything. And I let them know that it's possible that when it's all done, they can come back on hospice. I don't ever guarantee, because we don't know. That's ultimately up to the doctor if they bring them back on. But I also let them know that this, to help them understand, do you want the treatment? And if they say, well, no, I'm not going to have any of those treatments done, then I'm going to have the conversation with them that then we probably don't want to go to the hospital. There's really, it's no benefit for you to know what's going to happen. We're going to treat your symptoms. We're going to keep you comfortable and as healthy as we can. Going to the hospital has a lot of risk. The ER, your risk of infection is great. If they keep you there for a couple of days of observation, even in those couple of days, you're probably going to become more debilitated. In my experience, when patients come back from the hospital, they're always a little bit more debilitated than they were when they went in, and they don't usually get that back. So it really can affect their quality of life. And then if you do find out that's what happened, then it's just something you're going to be worried about. So it's going to weigh on you emotionally, and that can affect how you feel physically. So if they don't want to have treatment, staying home and letting hospice treat the symptoms is the best choice. And we are doing something for those patients. We are treating them the way that we treat them as hospice nurses. So I hope this tip was helpful. If you have any tips that would be helpful for hospice nurses, please let me know. I'd love to share them here. And remember, together we can change our world.